Zem Podcast, the conversations that shape a healthier life.
Welcome to Zem, and we are really happy having you here. First of all, let me introduce Dr. Oliver Zolman, graduated in King's College London, is a leading longevity doctor and scientist specializing in evidence-based longevity and experimental rejuvenation medicine. So his practice integrates advanced diagnostics, biomarker-driven risk stratification, and personalized intervention targeting the biological mechanisms of aging. Dr. Ayla is renowned for trauma and critical care expertise. She got her PhD in psychiatry in Cambridge University. She has compiled a library of over 95 psychedelic compounds that exist in nature. And she's using AI and machine learning to identify which compounds have the highest potential for drug discovery and for treating psychiatric disorders. Francisco Mira is a consultant neurologist. He was awarded with a national prize in medicine, the field of neurology, for his innovative techniques and advanced use of therapeutic procedures that enable the treatment of brain disorders, including approaches that do not require pharmacological therapy. And he is the head of neurocognitive department at SEM. Right. So for Oliver and Ayla, how did you get involved in longevity, and how did you start working together on yourself and then implemented some protocols that you applied from Bryan Johnson, for example?
I think we just sort of naturally met at Cambridge and I was studying there. Oliver lives there. And we became friends. We had the same interests in terms of research, and we just started pretty much testing on each other, right? So it was very casually how we began. We didn't have a clinic back then. So we were doing very kind of basic tests, skin related initially. We booked out, I was looking at supervision rooms in college at Cambridge. We were, closing the blinds, I remember the curtains, so as people wouldn't see what we were doing, what we were up to, because the lasers were like flashing and things. So it all started off kind of very casually, just us being guinea pigs on each other, mostly me being the guinea pig, I guess. And then, so that's how we started sort of developing some of the protocols. And then slowly we started testing some of those Bryan Johnson, and it became more and more, and Oliver started developing many more protocols, and now it's like 82 protocols in longevity. Yeah,
it's really amazing. So you're really pioneers on this, and it's interesting how these protocols and how this collaboration starts. So it's really interesting and amazing to see how you both worked together. Okay, so I would like to talk about brain health. Okay, so in terms of brain health, to me as a doctor, I feel we have the three killers. It could be more, but mainly cardiovascular, which includes cerebrovascular disease. Then we have brain or cognitive deterioration, and then we have cancer. So if we address the two of them, at least, involved brain. Okay. So what do you think could be the most prevalent conditions or the main problems we face currently for humanity in terms of brain health and longevity?
Well, Alzheimer's is still increasing, isn't it, in terms of cases per year, I think. Aging population, pyramids, etc. So I think, it's still a huge issue. There's, of course, we have p-tau 217 now as well, but it's very expensive to do. It's not scalable for one of the less economically developed countries. So I think it's still unrealistic to expect good results in Alzheimer's, especially once you're moderate or severe. When you cerebrovascular dementia as well, mixed dementias, etc., similar situation. But I think, the most promising point is at the MCI, or the mild cognitive impairment, and early stage Alzheimer's. That's where we're starting to see clinical trials showing possible effect sizes, and sometimes with cheaper interventions as well, like ketogenic diet. There are some Alzheimer's cases when they're mild can respond to that. Other types of lifestyle things as well. maybe hyperbaric oxygen therapy in some people, possibly. But yeah, it's still a very big problem, especially on the diagnostic side.
I think also cardiovascular conditions related or having as a secondary endpoint the brain malfunction or brain problems are also one of the top of the list. So that's why prevention is so important in terms of cardiovascular prevention, which starts and which includes all the lifestyle habits that we all know. In terms of assessment or early detection of conditions, what do you usually use in here to detect very, very early any deterioration, including deterioration that is not or is more intense that we would expect by aging?
Sure. The thing is that I have two different profiles. One is the clinical one, and is what we do in the clinic. And then is the preclinical one, that is the most important one, but they don't come to see us. So people is having MCI signs and they are not coming to see the doctor. So this is one of the most important things because we are getting it late. We arrive late because they come maybe 5 years after the big cognitive problems. They decide, let's see the neurologist just to see what's happening at one point. So we need to change the paradigm to the preclinical side because now we know with the AI we can diagnose cognitive impairment just by voice, hearing how you read a short sentence or how you speak normally in a natural language.
Are there any validated tools to detect that on an early stage?
There is one very interesting one. I don't know if you know them. Is the Linus system is American one. He's one of our colleagues, Alvaro Pascual-Leone. He's one of the Harvard neurologist doctors, most important doctors there. He's my partner in crime in different things. So they have the Linus system. It means that you know the clock test, right? It's a jobbing clock test. So it is a kind of computerized jobbing clock test, but they are reading not only the final output, they are reading how you do it in terms of time, pressure of the pain, trials, So
Even pressure of the brain.
they have almost like 200 different issues that they are checking it, and it's absolutely validated and correlated with the PET tag. So with the amyloid tag, AFP tag is so absolutely clear in FDA. So I think that they all the FDA approval maybe last year, and this is a very they have these kinds of diagnosed tools, and it is focused for the primary care doctor in America. So if here things are difficult, let's imagine what's happening in the States. Bigger distances, bigger differences, economical issues. So the point is that you have the Linus test. If we see that you are having a problem, then you should see the neurologist. So
I guess the important thing to note there is that you're not actually necessarily diagnosing a patient at that stage. It's not about labeling a patient. You're just trying to get a baseline result, right? You're just trying to assess for
a warning sign.
Exactly. So it's like a baseline cognitive health measures that you're doing so that you can follow up patient.
And in Finland, it's very cheap because the license is like 300 euros per month for your clinic. So
you're getting a tool that can be validated with over CT scan and PET scan. So
this is what they have for the diagnosis, and they have a very big platform for clinical trials inside. So it's very easy to companies just to have very accurate cognitive measurement with this kind, not only the clock jobbing test, but different tests that they are from the platform. So this is very interesting voice things.
Yeah.
And I'm quite sure that in the future, it won't be very long that because now we are diagnosing with MMSE, with mini mental status and these things, and you draw the clock. My patients, some of them, they don't know how. The future patient, they have never seen a standard clock. So I think that we will find something to diagnose cognitive impairment in how you manipulate the WhatsApp. Recruiting, how you do, let's say, in your previous 5 years, how you are the trial and error, and how you do, keeping those data. And then as soon as the machine detects that you are having some issues, then sending a warning sign.
Yeah.
So this is something very easy to do. And I think that it will be here. And we
Maybe-
should found a company now.
Maybe Apple would integrate it
Yeah.
like they do with other
Yeah.
Yeah.
other kind of
So-
autonomous algorithms.
This is, I'm sure they're probably working on that already. And I know there are some tools like Cognifit and so on that are using those variables to check and to monitor.
The problem with the Cognifit now is that you are going to the computer to people who has not very used to have the computer. They are not computer natural. They are 75, 80. Maybe you can have 80 years old guys very, very familiar with the computer, but some of them, they aren't absolutely. And then you have false positive results just because the performance is not good, but not because of the brain, just because of the how you are measuring it. And then the phospho-tau 270.
Yeah,
So
that's another one.
that's what we are doing in our hospital. And
No one can't lie.
yeah, and we have the paper maybe 2 weeks ago saying that healthy people, you can measure the phospho-tau 217, and then it has very good correlation. And if you are going to develop beta amyloid deposits in your brain, so
What do you think about someone that has high p-tau 217, but their age 30 or 40 and no family history?
that's very interesting because
Something I've been seeing.
you see that with the same thing with ApoA. So you see it. At least that patient has to be in a very close monitoring, let's say, protocol, at least. And I am a truly believer that we should start everything, not as a clinical labeling. You are an Alzheimer patient. It's okay. Take it seriously because you have more options to develop dementia. But if you follow these different ways, treatments, I don't like the word treatments, it's like interventions. And then maybe you won't reach the dementia, or maybe it will be less aggressive.
Yeah.
But at least you should do something with them. Because you
So
cannot-
it is a risk factor.
yeah, it is absolutely
Even
I agree. And I think it's so important knowing that, that the Lancet Neurology, the Dementia Commission, they say that 44% of dementias are avoidable today, just focusing on general, let's say, general hygienic factors on diet and hypoacusia, visuals, or blood disturbances. But we need more things. We need the mitochondria, we need the blood test, there being a special blood test just to know what's happening, not only in the genetic, structural, going how you are performing. And we will find some biomarkers. And
Do you use in your biomarkers or in your organ aging biomarkers? How many do you use for brain? Yeah, exactly.
It depends how you classify it, because MRI, you can get so much data and you can classify it one way or whatever. But you can think about it in terms of sequences. So doing a multi-parametric MRI, you can get a lot of info. Particularly Alzheimer's, you're looking at white matter hypo intensities or hyper intensities if you're doing T1 or T2 flare, and then ventricular volume sizes, for example, as well. But what is the actionable info? I'm not sure, because it's easier to measure p-tau 217 and bring that down, or even like MoCA or cognitive assessment scores. It's easier to use this as an outcome in a trial, but stuff to try and reverse solids, white matter hyperintensities on MRI scans, there's always trials using it as an endpoint. It's more like an exploratory secondary outcome that they're tracking. So we don't really know how to reduce those, even though they are, accumulating not linearly, but exponentially with age, and even more so in Alzheimer's compared to normal aging.
So we are talking about dementia and cognitive decline, but there are some other conditions like depression or anxiety, stress, PTSD that are really prevalent. Do you think that can also affect aging? And apart from some markers that we can detect, or obviously when patients have an issue and they come for help, are there any other markers that can indicate that there is a problem with that?
Yeah, absolutely. I mean, the secondary symptoms are so important, like the depression and anxiety that you mentioned, and then post-viral inflammation, for example, or any other psychiatric disorders or symptoms. These all contribute to aging. And so I think from like chronic stress, even burnout, we also live in a very kind of digital world, we're immersed with technology, using laptops and phones more than ever. which has an impact on brain, and sleep deprivation are the really important one. These, yes, secondary symptoms definitely contribute somewhat to aging, but they can be addressed. So as you were pointing out to before, some of these interventions don't even require medical assessment, and those are the ones that you can gain a lot more from, actually, just making small adjustments in like diet, sleep, stress. These add a lot more onto longevity as well. And I think it's important to point out that even looking at Oliver's longevity school protocols, mental health is actually ranked at one of the first or the second. So it's sort of up there with smoking. You can plus or minus 10 years of your life, depending on whether your mental health is intact or not. So, it's the same with smoking, plus or minus 10 years, right? So and all the other biohacking, the diet, the sleep, the exercise, taking, 60 vitamins a day or whatever all these biohackers do, all that comes further down along the list, right? But mental health is like at the top, and it's one of the ones that is completely overlooked. It's underestimated by medicine. It's one of those invisible disorders that we don't focus on, but it definitely requires a lot more attention.
Yeah.
And again, I could add one thing here about depression and mental health. Okay, it is underestimated, and it is overtreated with drugs. With drugs. So I'm completely against drugs. At least we know with antidepressants, they are at least moderate effective.
50% antidepressants, yes. That's
At least.
Yeah.
The second one, I have seen patients with 100 different antidepressant in his history changes.
Yeah.
So we know that after the second one, you're not going to get nothing. After the third one,
Correct.
nothing from nothing. Nothing.
So I think like the scientific evidence actually shows that antidepressants work for about 50% of patients with depression, and then the other 50% it doesn't work for. But for the 50% that it did initially work for, 80% of that group will go on to relapse again.
Yeah.
And take antidepressants again. And the thing with antidepressants is like you have to take it for such a long course. It's 6 months minimum for them to be effective. And to be on antidepressants for 6 months is a very long time. To be on any drug for 6 months is a very long time, right? So I'm very much in favor of the holistic approach to things.
Because, there is one side, and because it is my field, I am super fan of my field, is the brain stimulation. Because I think that brain, it is something different from, let's say, liver or kidney. You cannot push your kidney to work more, maybe drinking more, but you can push your brain to work better and to work more, or you can push some area and you can switch off another area with a non-invasive treatment with a TMS. We have the TMS, it's local in Spain, but the TTCS with home devices is completely legal in Spain. So we are using it with a home device, not the Zolman and these things that they have approved in America. They did it 2 months ago, and we are 2 years here. We have the devices here. So we see how you can treat a patient, you can have at least the same result without the side effect. So no sexual dysfunction, no waning age, no other things. So people is quite happy with holistic interventions.
Absolutely, yeah.
Here in Spain, 80% of people over 60 years, they are taking antidepressants or
benzodiazepines, which are very addictive.
Yeah.
And the bigger issue that I see with patients, coming to me, they say, how do I get off it? How do I get off it? It's so incredibly addictive that, just tapering patients off it, even lowering the dose slightly, they absolutely notice massive side effects, and you really struggle getting off these benzodiazepines for years.
And they're negatively related with cognitive
Absolutely.
and decline, and also with longevity
and hip fractures, and then dying because of the hip fracture.
So yeah, I totally agree. I think in this kind of intervention, other than the conventional drugs, are really, really important. But sometimes we also dismiss some other interventions, like properly managing your stress, having contact with nature. I think more and more we are listening to some doctors talking about that, but until not long ago with just doctors would talk about drugs and medication and everything. So I think we are all realizing that it's not all about drugs.
I think that we are biased here.
Yeah.
Because 95% of doctors is drugs.
Yeah, and I was then our philosophy, and that's why we combined all the different interventions that you can do for health, not only brain health, but combining nutrition, combining stress management, combining wellness. So I'm put down to that you use any possible method that has proven and still to prove some effectiveness and evidence in order to improve health. And I think for mental health was also really important because we've lost contact with nature. I mean, that's probably part of it. You know that there are also some digital tools for depression and stress and anxiety management. But again,
But why use digital tools when you can go for a walk in nature?
exactly.
And it's just so simple. It sounds
That's how it is. Yeah.
People think that, oh, I need to do something really special or something different, or I need a medical intervention. You don't. You know, having just, going out, wandering with nature, taking holistic approaches, lowering your stress, improving your sleep, things that we already talked about. These will build a natural mental resilience. Also, social interactions are very important. We saw this during COVID, right? COVID times where everybody was locked up, they couldn't go out, and people were really struggling mentally. And mental health sort of became a real thing then. It's like nobody had heard of mental health before COVID. Do you know what I mean? Because they couldn't go out, they couldn't socialize, they couldn't even exercise. So this is why it's super important to be able to just do even like the basic things that don't require medical intervention.
Yeah, definitely. So we've talked about brain stimulation. So obviously you use it within a program, a holistic program. And what would include that brain stimulation together with some other interventions? Because I think you also include even exercise on there, and particular exercise.
I think that the magic bullet does not exist. So you need a combination of different things because if not, you're just stimulating your brain. Okay, you go out and the brain is open, then nothing happens. But you need always to combine. Let's say before or after, it's good if you prime your brain with some good things. That we always say, put the brain in the state in which you want it to be later. So if it is relaxed because you want to fight against anxiety, first you start with his or her favorite music, relaxant, just a good conversation. Then you put the brain in the mindset or neurofeedback, whatever, and then you go with the TMS in that point. But today we know exercise. We won't discuss if it's 7,000 steps or 10,000 steps a day. We know that it's steps a day. As many as you can. We know that the strength exercise is sometimes better than cardio. You need to have very good combination. We know that addressing the mental health issues, maybe not the complete depression, but this is the normal sadness, and we will put it down again. Everything will be fine. But it's a combination, and it is not a one shot. This is the other thing. I think that your protocol could be the same. It is not a 1 day, 1 week, okay, I will be with you 1 week and everything will be solved. No, it does not happen like that. It's music, it's exercise, it's nutrition, it's conversation. If you do TMS and the patient is with eyes closed, it doesn't work. It has to be involved in the conversation. It has to be focused on what you do. We know, for example, in Alzheimer, we know that we have, not in Alzheimer, in every single patient that we do TMS, we have 2 hours is the golden window in which you can do whatever you want with the brain and you will have a better result in those 2 hours because the brain is excited with what you have time. But then you have the vagus nerve stimulation. I think that you are familiar with TAP in here with NeuroSim and other devices.
Yeah.
And it is quite good because you can see how stimulated the vagus nerve, you can reduce inflammation markers in your blood. So the final word is, it's a combination, it's a program, it's a training, and it's a way of life. And I am not very happy people taking 25 vitamins a day. They come to the office with the big bag, the trolley, and I say, okay, but what are you doing effectively? Because if you change the diazepam by the vitamin B12, you are again putting the control outside of you. Yeah. And you need to take control on your health. It is not the vitamin. Yeah. Let's go out, go with a friend, and then maybe eat some salmon, come back.
Do some meditation, mindfulness, and let's not forget the importance of meditation as well. I wonder if you've tried meditation with TMS. Do you find that helps patients a little bit more?
I'm quite sure that there are some papers in that way. We're not doing this in the meditation yet in the hospital because, hospitals are like clinics and they are not very open,
Not very holistic.
Yeah, not very holistic. But this is something here at SEM.
Absolutely.
So that we're going to measure the biomarkers, some of them before and after SEM. We know that some of them will need a very long intervention, but some of them will need a very short intervention. We can measure things.
Yeah.
Because mindfulness and meditation is crucial.
Absolutely.
It's the way in which you put your brain focus, maybe at least not damaging you. Because this is normally when you are under stress, you're allowing your brain to damage you. I will say to my patients, the brain is not intelligent. It's just efficient. So if you are thinking black, you never think white. You will be an expert thinking on a darker and darker black every single day. So we need to put the brain in the right. And I'm happy because the brain reacts to what you do, not your kidney. You cannot say your kidney produce urine. It's not going to happen. But you can focus and
take
you can
control over
take control of your brain. But people decided to give control to meds.
So I'm really happy to know that we more and more talk about meditation and all the effects, and obviously because we are getting more and more evidence on that. And just talking about evidence, I would like just to finish it with think of what is coming next. So talking about research on all these conditions, what do you think we are going to see within the next few months or few years? What is about to come?
Our results, because we are having a program treating dementia and my cognitive impairment, but dementia, not only Alzheimer. We are treating, let's say, cognitive damage people. And we started with the precuneus stimulation. It's in the parietal lobe in the brain.
So the patients already have mild cognitive impairment?
At least they are on MMSE, the mean is 22, but we are from between 14 to 25. And now we are having results 4 years later, and they are having 20 minutes per week treatment. We are keeping 76% of them. They are stable cognitively. So MMSE is at least the same that we had 4 years ago. And then only 24% is getting worse and worse and worse. So where we expect a decline at least in 8 points, because normally we expect that MMSE will decline 2 points per year without treatment. Yeah, this is what we expect in a dementia patient, okay?
Yeah.
This is the clinical trials and the papers. So we are not only keeping them in the same point, 76%. So we are, some of them, 24, improved. And we have the FDT PIT. And we have year 1, year 2 is better than year 1, year 3 is better than year 2.
Oh, wow.
And so that's what we are going to publish in 2026. So we are super happy to see, and we are not believers at all in the monoclonal antibodies for Alzheimer's.
Yeah.
Where we cross the data from TMS with the monoclonal antibodies, you see that they are much, much, much more expensive. You have much more
expensive.
And we have maybe an 18% improvement in 3 years after expending $90,000 per patient.
Yeah.
That's so clear. And I think that the brain stimulation are now with the home devices. So you can put your program working plus adding the home devices. So you are approaching the both sides, like nurturing the brain, keeping the brain, but forcing the brain to work. Because this is the other thing. If you don't force it, it will not work.
But you still need to push.
It does.
Because it is efficient. If you don't do nothing, you will be a perfect expert in doing nothing.
Yeah, exactly.
So we are going to publish those results in 2026 here in Spain.
I just want to add that with psychedelics, there's research indicating neuroplasticity effects. So looking at certain lab studies done in Petri dishes, for example, where they're injecting LSD and dimethyltryptamines with DMT or MDMA, and then comparing it with a saline condition, what they're finding is actual growth in the cells and dendritic spines, so suggesting neuroplasticity. And it's the same for like ketamine studies as well, where they're seeing synaptogenesis. So obviously this is very early research and it's still very much in the preclinical stages. Neuroplasticity in general is quite difficult to measure, right, Ollie? You know, it's not something that we can systematically measure for in the brain in patients, but we know it exists. Even just the effects of exercise, we know it will contribute to neuroplasticity, but it's an exciting area to look out for, because if in fact psychedelics can promote neuroplasticity, so there is indication that it can also address symptoms of dementia and Alzheimer's disease or Parkinson's or any other neurodegenerative disorders. So yeah, watch out for that space in psychedelic medicine.
I think it's a really interesting field. I think doctors are looking into that more thoroughly in the last few years, because it used to be something really avoidable topic. But now we are seeing more and more results, and we don't have many compounds, either natural or artificial, that can create that neuroplasticity. So that field is amazing, having something that has a possibility. And obviously, I think the main target is having the proper, how can we develop that neuroplasticity, or can it be influenced by the setting?
Yeah.
And how you do the therapy together.
Protocols behind it as well. It's moderation as well, and a combination of factors. It's not like we mentioned before, you got to do the work. The psychedelics don't do the work themselves.
Okay.
You still need to do the integration therapy afterwards. You know,
Absolutely.
you still need to be able to do like all the holistic approaches, the meditation, the mindfulness, and
They're not magic pills.
they're not magic pills. Yeah, that's one of the cliches, or what people think. Oh, I'm just going to take this magic pill, this psychedelic, and then I'm just going to be reset my whole mind. It doesn't really work that way. There's a lot of work that the patient needs to do themselves, follow up and journaling, integration, meditation, mindfulness, and all of that. But it's
really exciting. It is exciting. And I'm sure at SEM we will be always alert to see what's going on in there, and all the research and the new discoveries that are appearing. We want to be on top of that. And again, knowing the evidence that we are getting with the current interventions that we are actually doing now in real people and real patients, it's going to be, there's a lot to come, and really, really exciting. So thank you very much. I mean, it's been lovely to talk to you. I would be hours talking to you. Thank you very much.